Autistic traits can often get confused with traits of borderline personality disorder, particularly in adults. What I want to do is compare some of the cardinal traits between these two conditions in the hopes that people are better able to discern these two conditions when presented with one or the other, especially in mental health cases when people are in some kind of distress. Now, I am not a medical expert. I hope to at least shed some light on this particular subject and help people better discern these two conditions, particularly in adults who are experiencing mental health issues. How this usually happens is adults will come seeking mental health support, mental health services, because they are experiencing a wide range of symptoms. And counselors, GPs, psychologists, and even psychiatrists who don't necessarily know a whole lot about a patient's past, or don't have a whole lot of history with this person, or who may have a lot of history with dealing with physical ailments with this person, but not necessarily mental health concerns, they might start checking off boxes in their head for the criteria for personality disorders. And autism will never cross their mind because they don't necessarily know this person as a child, and they themselves might not have the proper background to assess autism in adults without that kind of knowledge. In addition to this particular area being overlooked a lot of times, that because autism assessments for adults are typically not covered under public health services, the doctor in question might not know where to send this person. And if they send them to a psychologist at a mental health clinic, or they send them to some kind of psychologist or therapist, they might not know what to look for in this person to start the process. And often the doctor can't refer them to the proper services because they're private, and the public institutions don't always communicate properly. You can go look for this yourself, but you're gonna have to pay for it. An easy way to discern these two conditions when we're diagnosing borderline personality disorder, we typically look for within the realm of relationships and how this person is viewing themselves and how others view them and how this person is viewing others viewing them. Wow, that's a nightmare to think about.